Hello.
Hi.
Hello, my name is Andrea Hernandez, and the topic I chose for my informative speech in public speaking is humor in hospital settings. I believe my form is spatial. When I was younger, we lived on a farm in a town called Wetmore, Colorado. One day, my family and I were out feeding the animals when some of our pigs got loose. My mom set my little brother on the ground and ran away screaming, "Ah, the pigs are going to eat me!" It was so traumatic but hilarious at the same time. We all love humor, and we use it in many different places at many different times for many different purposes. Hospitals is one of the best places to use humor. I chose humor in the hospital setting because I believe that it really does help heal people. 3 of my main points are going to be why we use humor in a hospital setting, if it's appropriate, and what types of humor is used in the hospital settings. I did most of my research in the internet. Let's begin with the reasons why we use humor therapy in hospitals. According to the Journal of Cancer Science and Therapy, laughter therapy can help improve the quality of life of a person with a chronic illness. Studies have shown that some of the benefits of laughter therapy is that humor decreases pain by enhancing oxygen intake, improving mental functions, and relaxing muscles. It can also alter brain chemistry and boost the immune system. According to Canadian researchers, humor offers a humanizing dimension in healthcare. People often use humor in hospital to lighten the mood after they've had some bad news. Doctors and nurses use it to get to know their patients and connect better with their patients and their families. And surgeons often use it to take their patient's mind off an upcoming surgery or take their mind off the pain. E. Cummings said, "The most wasted of all days is a day without laughter." We have talked about why we use humor in the hospital setting. Now let's discuss the types of humor used in the hospital settings. I want to share a joke with you that I found in Whole Health. Patient says, "Doctor, doctor, my child swallowed a whole roll of film." Doctor says, "It's okay, we'll just see what develops." I know you laughed, which brings us to laughter therapy. It is one of the types that is used. In an article of Anatomy and Illness, a man named Norman Cousins said that with laughter and taking vitamin C, it helped cure his ankylosing spondylitis. They could also show a funny video, read a funny book, or use puppets to help patients. Another type of humor used is the shield against negativity. This type of humor is usually used with ADHD patients. It's to help keep them happy and positive so that they don't fall into depression. One of my favorite quotes by Patch Adams is that laughter is the best medicine. Knock, knock.
Who's there?
Interrupting cow.
Interrupting there.
Let's move on. Now we have talked about different types of humor. We will move into whether or not laughter in a hospital setting is appropriate. Fun fact, Dr. Campbell and others opened a free hospital using the laughter therapy on thousands of patients back in 1971. Humor in hospitals has been around for a long time, so therefore it proves it is appropriate, as well as most hospitals are now using what they call a humor cart. You could cheer up a patient with a funny book, with balloons, with little dolls that sing and talk, or even funny little toys. Or you can just throw them around and make them laugh as well. In some cases, like cheering up children who are sick, doctors and nurses have called in clowns. hospitals use carts full of funny materials for people of all ages. Although mostly humor can be appropriate in a hospital setting, there are times when it can be inappropriate. These times would be if someone just died. It would be if a doctor or a nurse made a joke about someone's illness. And there's also what they call a dark humor. Dark humor is usually where surgeons use inappropriately joking antics on sedated women or women in childbirth. This type of humor is sick and is not tolerated in hospital settings. We have now discussed if humor in hospitals is appropriate or not, so now we will review. Humor in hospital settings. There's lots of different laughter therapies and other types of laughter-infused humor. And apparently, there's now laughter yoga. We have now learned why we use it in hospitals, the types that we use, and whether or not it's appropriate. So laughter is a great tool in a hospital setting. It also helps many patients in so many ways. So I will leave you with a great quote by Patch Adams. Laughter is the best medicine. Thank you all.